today, and he's coming in for an apicoectomy. And if you look at my playlist on YouTube, I'm going to start to build more apicoectomies actually when I have time to talk about it. So we're up for another apicoectomy today, and this is one that he didn't even know there's a problem in his jaw until he came in for a checkup and we found the problem. So where the problem is, I'm going to direct you, is right over this mesiobuccal root right here of this molar. So here's a crown that I did for many, many years ago, and it's doing great. This is the old porcelain fused to metal crown. But still, the margins are nice. You see the just to digress here for a second, the margins of the tissue are pretty nice, even with the old technology. Why? Because the fit is really nice. So this is the way we used to do it. This was the best for its time at that time. Not the best aesthetically, but in terms of fit, very nice. So that's a metal, then the porcelain. I'll show you the metal right there. See that little peak of the metal? And that hugs the surface of the root so nice, and the tissue just drops back on that. Okay, let's go for it. So he needs the apicoectomy right here. Just turn towards me, Kev.
Mm-hmm.
So let's direct exactly how we're going to do this incision. We're going to go along the sulcus here for all the dental streams, very tight in here. Okay, I'll do a vertical, do a vertical this way, open it up wide. You want the top wider than the base. Go over here and make a nice tight cut up in here. Lift it up, lift up the tissue, expose the tip of the root, which is right here. And we're going to do like an angled cut to cut the tip of the root off. Clean out all that granulomatous tissue, and then we're going to go in with the high-tech end cutter. So for all you endodontists out there, every endodontist in the world probably has something like this. Who's an endodontist? That's a root canal specialist. But Dr. Ingber also has the material or the hardware technology to do the same thing that the root canal specialists do. And what it is, you can see this little 90-degree cutter here. This is a piece of fantastic equipment. So when I cut off, and let me explain to you what it does. So I turn it on, and it's an ultrasonic, and it's actually diamond coated. And in the tip of the root that I cut off, if I cut off, so imagine there's a root here that looks like that. I cut off the top, and it has a racetrack shape. So in the center of that racetrack shape, I make this hole here. Then after that, I make that hole in there, which I have to seal. I'm going to put in this material here from Brasler, the endosequence. This is the magic stuff, everybody. This is the magic stuff. Let's get a nice tight shot of that. Every specialist in every country of the world who does this surgery, this is the stuff they should be using. I can thank Dr. Wayne Pulver, who told me about it a few years ago, and he's the like top guy in Canada for the being a specialist, and he's the one. He says that this is the stuff to use, and this is what I use. So what's so special about this stuff is that it actually tricks the stem cells of the body to revert to osteoblasts. What's an osteoblast? It's a bone-producing cell that lays down bone. So there's something in the chemical mixture of this that causes that to happen. And gosh, I've used it dozens of times, and it actually works. It's a miracle of the progression of this therapy. Another thing that's supremely helpful also is vision. Now, there's UFC fighters, right? That's a very popular sport, right? Tremendous athletes, and they get pummeled for millions of dollars. But in dentistry, there's also UFC. And what does that mean? UFC is what's the best out there in terms of vision and lighting. So where I feel there's just absolutely no competition in the world, it's the light that I use here. So I haven't talked about this. People see in my videos, I'm wearing this all the time. This is the latest technologies from Designs for Vision. And you see it's a dual beam. See that? And it's 140,000 lumens. So you see when I shine into that area, it's supremely bright. So when I do the surgery, why is it so good? Because I can look deep into that cavity and clean everything out. Why? Because I don't have any shadows. Because of the dual beam, if there's something here in that cavern, if it's a single beam, it hits it straight on and there's a shadow behind. With the dual beam, I see behind it so I can see better. And now, when I do my surgeries, I'm rest assured that 100% of the time I'm cleaning out all the tissue. The progression of this surgery is actually tremendous for me, because I've been doing these surgeries for decades, and years ago, these surgeries were actually failing on me. I couldn't understand why there will be, like, let's say, some more infection, the patients are coming back with pain, stuff like that. And then I realized because we were just using an overhead light, which was inadequate to look into these dark caverns. And sometimes these defects in here would be many, many millimeters of volume to clean out, which sometimes takes many, many minutes. So that's what we're going to do for our friend here. I would also, another interesting thing about it is, if we look at the x-ray, the x-ray is actually quite revealing too. And what's revealing in the x-ray, we're going to look at the tip of the x-ray, okay? So we look at the tip of the x-ray, and the infection is all around the tip of the root here. See the coloration? So I'm going to go in here and cut off the tip of the root and put a special filling material in here. The reason I want to get the surgery done also is an interesting thing here, is that his sinus, his maxillary sinus, which is denoted as this dark area here, when we have colds in the winter, we get a mucus plug in here and we blow it out our nose, and this is where it's landing in here. So when we blow our nose, this is where it is. Interesting enough, where the infection in here is actually, you see there's actually an intimacy of the tip here of the infection actually with the base of the sinus. So sometimes in undiagnosed cases I've had where patients are having actually sinus pain or headaches, and they say they get headaches in their forehead. So why in their forehead? Because the nerve here is called a V2 nerve off the base of the brain. I forget what the nerve is, but what I'm saying is that out of the base of the brain you have a trigeminal nerve. It has 3 branches, so this is V2. So if there's infection here, this branch here goes up into the base of the brain and tells the patient, I have pain here. Other cases is because it's joined, so you have V1, V2, V3 nerves. So if you have infection here, the infection goes posteriorly. Instead of going up into the root first, it actually goes into V3. So patients will come and tell me, oh, Dr. Ingber, I have so much pain in the bottom tooth. When I examine, I take an x-ray and see, let's say the bottom tooth has nothing wrong with it, it's obvious that this nerve pathway has been triggered. So it's called referred pain. We were taught about that in dental school decades ago, and it actually exists. Referred pain does exist. So that's kind of cool. So the reason I also want to take this out is not only because of the pain pathways, is that the longer we leave it, the more we can get what's called a fenestration of the acidic tissue here that's burning a hole in the bone here, and then we can maybe get even if we wait long enough, we can actually get infected tissue and pussy-like tissue getting into the sinus and then having a different problem. So we're not going to get to that position. I've caught it early enough, and we'll do it there. So another thing is the crown that I did from a couple fillings here. We can also see the margin. This is really, really old dentistry. I'd have to check my records, but I don't even remember it. This is porcelain fused to metal crown. But even then, my margins were absolutely beautiful. And even today, they're just spot on. I love it. And this amalgam is perfect, and this amalgam is perfect. So I'm going to give that a 10 out of 10 for my nice patient here. Okay? Thanks.